Trends and Friends, everyone. Andre with Trustpoint Rehab Hospital of Lubbock is joining us. So excited to have you here. Whether it's kind of a weird time right now, new programs are happening, and y'all have an awesome program for people that have recently, had COVID and want to help them out. Tell us a little bit about the program and what it is.
You bet. Absolutely. It's great to be here. So the program is more or less a new initiative that we are starting at Trustpoint. So, we are in currently the second year of this COVID pandemic. And what we saw at Trustpoint was we saw a problem. We saw a problem in the community where a lot of the primary care physicians, the independent practitioners, the hospitalists here in Lubbock continue to see patients and individuals that have had COVID in the past, but they still present with some type of COVID-like symptom. So statistically, up to 76% of the patients that these medical care practitioners are seeing will still demonstrate with at least one type of symptom 6 months after their initial COVID diagnosis. So what those symptoms include, but not limited to, muscle weakness, fatigue, issues with swallowing, headaches, sometimes even insomnia. But one of the biggest and most important symptoms that we're seeing are changes in their cognitive function also, so in their thinking, right? So what we kind of call that here is brain fog. That's typically the phrase that we like to use here. And so we saw this as an issue, and these practitioners really don't know where to send these people. So what we wanted to do was start an outpatient program with a very specific protocol that can help these people get back to independence, get back to their life, and get back to where they were before their diagnosis of COVID.
Yeah, it's definitely a scary thing, especially that percentage. It's very high, which I was definitely not expecting. How do people reach out to you? And is this going to go through insurance? How does this kind of all work?
It's a great question. So there are two main ways you can reach out to us. Probably the easiest way is for anyone out there who is dealing with these post-COVID long hauler type symptoms is get in contact with your primary care physician if you have contact with one, and just ask them for a prescription or a script for outpatient physical therapy at Trustpoint Rehab. They will immediately send it to us and we will get you on the schedule. If you don't have access to a PCP or a primary care doctor, then you can always call our main hospital line and we will get you connected with us and on the schedule as soon as we can. And I have that number for you. It's 806-749-2222.
Thank you. That's so awesome. I can't believe that so many people, are y'all already seeing a lot of people come in for this? How's it been going?
It's actually been going really, really well. So within our hospital system, Trustpoint Rehab Hospital is a test site for it. And we actually have had a few patients come in with these post-COVID-like symptoms. And what we're doing with them is going through the normal protocol of an outpatient rehab program, but we're getting very specific and targeting the individual symptoms that they're having post-COVID, which are inhibiting them or stopping them from getting back to what they want to do, whether that's getting back to work, getting back to school, or even just getting back to what they used to love to do before all these symptoms started. And we've had pretty good success so far.
Well, I'm so glad for you to be here and tell everybody about this. I hope this helps some people.
Thank you so much. Absolutely. Thanks for having us.
Of course, don't go anywhere. We'll be right back with more Trends and Friends.